Welcome to the Dental Capsule. In this series, we'll cover different dental topics and real clinical situations in short, easy-to-follow capsules, designed to help us improve how we manage our daily cases.
Today, in this case, we are going to have two main questions. Are we going to extract the wisdom tooth only, or the wisdom tooth with the lower second molar, the lower 7? And the other question is, which tooth is going to be extracted first, the wisdom or the lower 7? So in this case, the patient came to our clinic complaining of a severe pain in his lower right quadrant. The patient has been acknowledged before that the lower wisdom is horizontally impacted and has caused caries in the lower 7 due to the food impaction in this area. But our question was, are we going to extract the 7 or we are going to keep it? When we evaluate such cases, we must evaluate the amount of the caries, its extension. Is it approaching the pulp or not? Its relation to the root, to the level of bone. You may need to use other means of diagnosis like periapical X-rays or even cone beam CT. But in this case, we can see that the caries cavity is encroaching the pulp. It's encroaching the root. The bone level here, or the bone resorption here, makes the crown root ratio not good. So our decision here was to extract both the 8 or the wisdom and the lower second molar. In addition to the patient who was not willing to keep the lower 7, he wanted both teeth extracted. We will see in the last photo how we made a good decision here. Okay, so the other question, which tooth is going to be extracted first? The main traditional way, the main traditional academic way is to extract the wisdom tooth first and then extract the mesial tooth, which is the lower second molar. Some other surgeons may take the decision to extract the second molar first in order to provide accessibility to make an easier extraction for the wisdom tooth. We will see what we did in this case. So as we see here, we have the wisdom tooth partially impacted and buccally inclined. As we see here, it's buccal to the lower 7 and lower 6. So what did we do? We started to create a, let's say, a creative approach to this case. We started by removing the lock between the 7 and the 8, as we see here. So why did we remove it first? In order to allow us to apply a force by the elevator from the mesial of the 7 to push it into this space. So we started by applying a force by the straight apexo to push the 7 onto the space between the 7 and the 8 in order to luxate it. And after that, we removed the lower 7, the second molar, by the forceps. And as we see here, we have the lower 7 extracted, and we have a very good accessibility to the lower 8. And after that, we started applying force by the straight apexo in this space. As we see in this X-ray, we have a significant bone resorption due to chronic inflammation in this area. We applied the straight apexo in this area in order to elevate the lower wisdom tooth and luxate it for easier extraction, as we can see in this video. As we see, we applied the straight apexo here and started luxating the tooth. After the tooth has been luxated, we started grabbing it by the forceps and luxating it from the soft tissue surrounding it. Okay. So the question is, why did we do that? Why did we extracted the 7 first and then we extracted the lower wisdom? Okay, by doing this, we have saved a lot of time. Rather than opening a conventional flap in this area and removing bone, we saved a lot of time. We saved the patient a lot of trauma. We conserved the bone in this area, saved the patient from a lot of trauma due to the bone heating after bone removal, due to the mucoperiosteal flap elevation. So less pain, less swelling, less trismus, and less time and more efficient extraction and more easier experience for the patient. We only took these sutures in order to fix the soft tissue. And as we can see here, we have both teeth extracted. This is the lower wisdom with the lock removed here. And this is the lower 7 or the second molar. And as we see here, we have a large carious region almost reaching or encroaching the middle of the root. So it was a good decision to extract the tooth. If you have any questions, please don't hesitate and let us discuss together. Thank you.
Thanks for watching. If you found this helpful, don't forget to like and subscribe. Share your thoughts or questions in the comments. We'd love to discuss them with you. See you in the next capsule.